Why did it take so long to install toilets and hand-washing stations downtown? As hepatitis A spreads, city and county officials blame each other for inaction. 1 year after Alfred Olango was shot dead by El Cajon police, has anything changed for the better? And the Delta Project would bring water from the Sacramento Delta to Southern California for $17 billion. Is it a needed fix or just too darn expensive? I'm Mark Sauer. The KPBS Roundtable starts now. Welcome to our discussion of the week's top stories. I'm Mark Sauer, and joining me at the KPBS Roundtable today, watchdog reporter Jeff McDonald of the San Diego Union-Tribune. Hi, Jeff.
Hello, Mark.
Good to have you back again. Editor Seth Combs of San Diego City Beat. Hi, Seth.
Hi there.
Glad you're here today. KPBS Evening Edition anchor Ebone Monet. Hi, Ebone.
Hello.
Glad you're with us. And Eric Anderson, who covers business and the environment for KPBS. Hi, Eric.
Hi, Mark.
Glad you're here today. Well, excuse me, at least 17 people have died and hundreds more have been sickened by San Diego's hepatitis A outbreak. The public health crisis, which has become national news, took months to develop. Now we're getting insight into reluctance by public officials to step up with measures to knock down the deadly disease earlier on. Steps could have been taken months ago to control the virus, which thrives on unsanitary conditions common among the homeless population. Jeff, tell us about this back and forth. What are they saying, these officials with the county and the city?
Well, the city says it's the county's obligation to take care of the public health, that the county is the county's doctor, the county's public health doctor, and the city doesn't have its own public health department. So the county should take the lead addressing the hep outbreak. The county says it has approached the city repeatedly since early May about specific steps to take and gotten nothing but foot dragging.
And a lot of this centers on blame being passed around with the installation of more toilets downtown and hand washing stations, and who's saying what? Why didn't that happen sooner?
Why didn't that happen sooner? Well, as I say, the county says they pushed forward as early as May. The city resisted it for reasons that were not stated publicly in the records we've obtained. The city says that's not true. They've been working to address this and accommodate the county any way they can help, except the county dragged its feet, providing the sinks and any portable toilets. Now, those are critical responses to the outbreak because the virus is transmitted by unclean hands and lack of sanitation.
Lack of sanitation, that's the key problem here. And you had to file a Freedom of Information Act to get at a lot of this that was going on. They weren't that forthcoming with this info.
We filed a number of Public Records Act requests. We're starting to get them back. I actually am expecting one this afternoon, so there may be additional information on this very question over the weekend or early next week. But yes, we got back maybe 80 pages, hundreds of emails to and from the city and county, none of which were any smoking gun documentation, but all of which show that there was a general lack of urgency on both sides to address this issue in a speedy, efficient way. And I should say that the emails are between staff people, not the policymakers themselves. So
the folks in the trenches that are doing
yes.
the work of this. Some of the things, examples in your story, something as simple as a poster to get basic public information out.
Months.
It's
yes,
just hard to believe when you look at the details of all of it.
It is hard to believe. Some of this is to be expected because government is at every level is a big bureaucracy, excuse me. But also you like to think that when there is a crisis, your local government will step up and address the issues that need addressing.
Eric?
You talk about this being a back and forth from May, but isn't this a problem that has developed over a much longer period of time?
Yes. They first identified the anomaly in the caseload in early March, and they nailed it down, I think, in the second week of March, they being the county. The epidemiology staff always looks at different outbreaks of all cases of any kind. They do that routinely. Once they figured out what they were dealing with, they started sleuthing them and reporting them the same way we all research stories. They got back as far as November and identified a certain number of cases. Then by April, the number had spiked again, and I don't have those off the top of my head, but it wasn't in the hundreds, it was in the dozens by April. And so that's when they started scheduling meetings. They met with the city. That meeting was May 4th, I believe.
So the problem was underfoot for some time before these back and forth discussions between the county and city were happening.
Well, the incubation period is a long time, I understand, up to 7 weeks plus, and so they're not always aware. They don't know how widespread it is. I've asked them this week if it's crested yet, and they can't tell us because the incubation period is still underway.
A lot of people think it's going to get worse. Mm-hmm.
I want to ask you about your editorial in City Beat. You said the officials here finally sprung into action when some national headlines started coming out here.
Right. I think it all really happened for me when I was talking with my mom about coming here to visit, and she was like, "I don't want to go there."
And where's she?
She's in Costa Rica with dengue carrying mosquitoes, and she was like, "I don't want to go to San Diego." And I was like, "Okay, well, it's really not." I tried to downplay it just to get her here, but anyway. But yeah, no, it's really, they've really sprung into action, and ever since it's made national headlines. So once you have the New York Times, the LA Times.
Yeah, what are some of the headlines? What are sorts of things they're saying about us?
Yeah, well, they're saying, you look at some of these headlines, like there was one, and I reluctantly point this out, there was one on Breitbart saying, criticizing, a Republican mayor, and you're sitting there going, okay, well, if Breitbart has a headline saying, like, ineffective government in San Diego or something like that, then it's time to pay attention maybe, yeah.
So how did the mayor and the other local officials kind of react to these stories? Was this a tipping point or just coincidental that the timing came after this?
They're doing what they can. I mean, as Jeff succinctly pointed out, this could have been dealt with in a much better way beforehand once they started reporting these cases, but once it was clear that it was a dire emergency, there was a lot of press conferences and the vaccination, vaccination, education, and what's the last one?
Sanitation.
Yes. And, so they have this campaign going now. So there was a lot of, press conferences and saying like, we're going to do this. But it's worth pointing out that the mayor in his State of the City address, made this his #1 social services priority.
That is homelessness in
homelessness in general. And then he tried to, attach some money to a special election. But, that even if that special election had moved forward and the city council had approved it, it wouldn't have happened until November.
Yeah,
this is October. Yeah,
affected this situation here.
So it's bad.
But we do have many more hand washing stations, many more public toilets downtown. Where we talked about this last week on the show that for years they were reluctant to get these toilets because they bring their own sets of problems. Any idea if those problems are coming up? That would be drug use, prostitution.
We haven't heard of any specifically. I suspect if they were becoming a problem, we wouldn't be hearing about it because the sanitation is such a key issue right now. We'll have to wait and see how that shakes out. They've only been in place for like 2 weeks, maybe 3.
Right. Yeah, and I was just telling Jeff outside. There was a gentleman that contacted me. I'm reluctant to say his name because he went off the record, but he tweeted out to me, and I followed up that he was, what little bathrooms they had downtown before this. He was warning the mayor's office 2 years ago about the lack of sanitation in those bathrooms, how they were unguarded, and yeah, it costs a lot of money to put guards at these bathrooms, but you see what happens when they don't.
Yeah. Now, I wanted to, a point you had made, Seth, in your writing about this was that the Centers for Disease Control have kind of a common sense thing of do's and don'ts on this, and the city is kind of doing one of the don'ts.
Listen, one of the main things that the Centers for Disease Control points out is that when you have an outbreak like this, one of the key things that you have to do is containment. You have to move I'm trying to put this in the most diplomatic way possible. You have to move that population together, and you don't want to spread them out. That's the key. You don't spread out the...
because the disease spreads when people spread.
Exactly. So that's one of their main points. And to the mayor's office credit, they have talked to the Centers for Disease Control, but I'm still not exactly sure what it is that they're hoping to accomplish by displacing these people who may or may not have this infection across the entire city.
And Jeff, the frustrating thing to a lot of people is in this country, this was a disease that was controlled. It was basically almost eradicated, right? And now so this is kind of a man-made problem here.
In the 1990s, the federal government approved a vaccine, and it went from 15, 20, 30,000 cases a year over 20 years to less than 1,400 in 2015. So yes, to see 400, almost 500 cases in San Diego is a huge anomaly. So it's
Now,
second largest since the 90s, right?
I think so. Yeah.
All right, a couple seconds left on this topic. I did want to kind of throw out, is this the kind of crisis that's out there and has got enough attention here locally and, as we've said, nationally, to maybe let Kevin Faulconer or city leaders come up with some sort of multi-billion-dollar plan to finally effectively deal with the overall homelessness problem? Is this the catalyst for that, maybe?
One would hope.
One would certainly hope, but we'll see. That's a lot of money, and no mayor has committed to addressing this problem in any serious way for decades.
Yeah, because it would be multi-billion-dollar.
Right, and it's also worth pointing out, like once you get past the money that's going to take to address this right now, how is this going to affect long-term tourism dollars? Things that that we depend on to fund anything.
Indirect effects on that. Well, certainly the story is got some ways to go here, and we'll be talking about it some more as we move on. Well, it's a distressing scene that too often ends in tragedy and reverberates across communities and the nation. A black man, often unarmed, is confronted by police and then shot dead. The scene played out in El Cajon 1 year ago this week. A lot has happened since the shooting of Alfred Olango, a native of Uganda, by an El Cajon police officer. Ebony, start with the basics of the story. What is known now a year out?
So we go back to September 27th of 2016, and Alfred Olango, 38-year-old refugee, he's in El Cajon with his sister, and his sister calls police and says that he's not acting himself. He's very paranoid, sweating, thinks someone's following him, and police don't immediately respond. He leaves her apartment and is actually in downtown El Cajon, and other calls start coming in from witnesses who say that he's walking into traffic and with no regard to the cars coming at him. Once police finally arrive, it's about an hour from the time of the first call. The sister calls a total of 3 times. There is an encounter behind a taco shop inside of a strip mall in downtown El Cajon, and it proves to be fatal. He is shot 4 times, and a second officer actually uses non-lethal force, which is a taser. And it was determined, according to authorities, that he had his hands in his pockets, and he took a threatening stance and held a metal object that was later determined to be a vape pen.
So the officer, Richard Gonsalves, thought that this was possibly a weapon, and the shooting occurred. District Attorney has since ruled on this case. What was that finding?
Not only did former District Attorney Bonnie DeManis say that this shooting was justified, she said it was understandable that the officer would have felt that his life was threatened because of the threatening stance in which Olango held this vaping pen.
Now, there was talk at the time, and of course this got a tremendous amount of attention here and across the nation, as these shootings do, about mental illness being a factor. What does the family now say was really the state of mind, or what's their best assessment there?
In this case, our Amita Sharma, she spoke to Olango's sister, Lucy, who was the one who initially called police and was there at the time of her brother's death. She says he was experiencing a mental breakdown. He had just lost a longtime friend to suicide, and the family said that he was emotionally in pieces. I spoke to Apollo Olango, Alfred Olango's brother, and he said that he was speaking to him on the phone, and he wasn't himself, he wasn't taking it well. And so they think this is what led to this mental crisis. And she said that she actually, Lucy, this is Lucy, said that she actually called police hoping that they could help her get him to the hospital.
Okay. Now let's talk about what's happened in this year since this tragedy. And you did a story with Apollo Olango, as you said, and talked to him. We do have a bite I wanted to set up. He's talking about why he wanted to create a foundation coming out of this tragedy. Let's hear that.
A lot of the questions that I was asking, such as why is my brother dead? Did he have to be? All those questions seem to push towards taking some sort of action. To have an in-depth understanding of the laws that justify these actions and as to why. If enough people feel about a law as if it's unjust or something is incorrect with it, every law is a living document nearly, and it can be amended.
So tell us, give us some details on that foundation. What's the goal?
So the Alfred Olango Foundation was launched just this last spring. And Apollo Olango says that he's still in the very early stages. He says he's just figuring it out. For the most part, what he has been doing is he's been sharing his brother's story, trying to raise more awareness about the concern. He believes that had a PERT trained officer been there, that this would have all ended very differently. So,
and remind us what PERT is. That's the specially trained folks who can deal with people with a mental crisis,
yeah,
and a confrontation like this.
And they're trained to communicate with someone having a mental crisis.
Okay.
So he's saying that he thinks that this could have ended so differently and that this could have been avoided. And so what the foundation hopes to do is to gather data and research and see where there might be a problem and where there can be added training that could potentially de-escalate tense situations and preserve lives. And so he's been meeting with folks and sharing those stories.
Eric?
I'm just curious, I know that there were some questions about a police review panel in El Cajon. Has anything else changed in this year since he was shot and killed?
Well, El Cajon still does not have the Citizens Review Panel, and that's one of the things that the foundation is advocating for. San Diego has one, National City has one as well. But no, we still have the same amount of PERT officers, there's 51 PERT teams in the county, and that has not changed. And in this case, that PERT team was tied up.
It's also worth pointing out that a grand jury recommended to the El Cajon City Council that they have these citizen review boards 2 months before, I think it was 2 months before the shooting. And it's funny because it's not funny, but the elections happened shortly after, and everybody who was elected to those 2 or 3 empty seats on the city council was all against the citizen review panels. So I don't see it changing anytime soon.
Well, I wanted to ask, excuse me, about Apollo Olango's push here, as we say, to get more awareness, more training. What's the El Cajon police reaction to that? Are they amenable to that idea?
So we reached out to the police department, we reached out to the mayor's office, and because of pending litigation, they decided not to take part in our reports. So it's not clear what the response would be about the foundation or the goals of the foundation.
And what about community reaction in the meantime, in the years since then? People you've spoken with, they say is the foundation some ray of light perhaps out of this tragedy, or is much changed at all?
Well, ideally with the foundation, they backed a bill, and the bill would have allowed for the police department actually to have the officer involved shooting to be investigated by the state attorney general's office, and then that bill was revised to be investigated by the Department of Justice, and that bill did not even make it out of committee. Okay. So at this point, there are some efforts being made to make sure that there's oversight when there becomes a situation where there's an officer involved shooting and there's not much confidence from the community that it's going to be investigated thoroughly internally.
This is the bill in the state Senate?
Yes.
Yeah.
Now, the last question on this, is there civil litigation involved in this case that's moving forward?
Yes, there are pending lawsuits. Lucy Olango is suing, as well as Alfred Olango, father of 2 and a husband. His wife has a suit as well. His father has a suit. So multiple members of Olango's family have filed suit, and they're claiming excessive force and as well as negligence on the part of the officer, because Lucy Olango insists that when the officer arrived, she told him, as well as telling the dispatcher over the phone, that he was unarmed.
All right, well, we'll see what happens going forward and follow up on that civil litigation. Well, there's an adage often attributed to Mark Twain: whiskey is for drinking, water is for fighting over. Well, nothing sets up a good battle like a $17 billion proposal involving water distribution in California.